Hello, this is Dr. Vasquez. I wanted to tell you a little bit about our app at Gbuahn. A couple of different buttons on the bottom. The first one is the doctor's button. When you click on it, it'll give you locations to primary care specialists and behavioral. Just by untapping, you'll actually see, the groups that you want to kind of go into. Once you pick a site, it'll actually give you more information on the particular doctor. So that's where that tab comes in handy. The next tab that we have for the app is actually hotlines, and we built in a lot of hotlines that you may need. One of them in particular is emergency crisis services. Once you click on it on your phone, you'll actually go to that number. I'll try to make the call. So I think for a lot of emergencies, it's a good site to have to begin to understand what the numbers are in case of an emergency. On top, so you have the directions. Tell a friend if you find the app to be interesting. You can email, face, tweet, and instant message to someone else. In addition to that, we have a lot of diseases that we put into the system, and these are real important preventive diseases. For example, for colorectal, you'll notice that someone 50 to 75 should have this test and why they should have it. So it gives people a good idea about the preventive services for cervical cancer, breast cancer, for depression screening, for slips, for falls, and lipids. And I think for a lot of the primary care patients, it's a real good way to kind of know what services they're going to need. Updates are good because here we're able to push out information. For example, if something's going on for the holidays, the season greetings, we want to wish you happy holidays. We're pushing information out this way. And also, if we have diabetic classes or different website informations from the website that we want you to know, that's how we're kind of giving you the updates. The More button, so there's a lot more information here, is the handbook. And the handbook section will have members in terms of being able to get a lot of the benefits that you have by joining Gbuahn and the Health Home. So that's in the members section. The next section that you have is you can share your experience, and that could be a voice file that we'll get, and we'll actually posting them on our blog. In addition to that, the care team. So you don't know which team you're on, you go to the green team, and here you'll know who's my community health worker, and their names and emails are all there, and exactly which offices they're working with. So this in particular is Raymond Torres. We're trying to keep these updated, so it would be nice to kind of get the most up-to-date information. And if you don't have access to that, or if you run into issues, you can always call our office. We have self-screening evaluation questionnaires, and here you can give us feedback on Gbuahn itself, and we really want to improve our services to the clients, because I think that's what we're here for. If we don't do a very good job with that, it's not what we're trying to do. Again, alcohol questionnaires. Once you do this, it's anonymous, and you can email. You put your email, and we'll contact you based on the numbers. So these forms will be reviewed by our teams to make sure that we're addressing the issues that clients may have. Referrals from the outside. If you want to kind of send someone to Gbuahn and you have this app, the referral is here and who qualifies for Gbuahn, in addition to the emails, and we could basically follow up based on the information you give us. What is Gbuahn? I think this button gives Gbuahn's mission in terms of trying to provide different types of non-clinical services and clinical services integrated for behavioral and primary care services. The More button is pretty interesting because here we are basically looking at a lot of different sections. In particular, is we have a little section within the button section. So it answers questions on the health homes. It answers who's involved with our corporate structure. We're also able to show you the different events that we've been engaged with in the community, and pictures of things that Gbuahn is trying to accomplish. If you have an event that's out there, we love to be part of it. There's clips of when Gbuahn has been on AM Buffalo, just talking more about the product and you can click through that to get more information. We included the Mayo Clinic because they have a lot of great sites for people to learn from. In addition, Gbuahn has a Facebook, a tweet, and a LinkedIn account, in addition to a blog. So, feel free to click into those and look at the different things that are going on at Gbuahn. In our Facebook section, we were involved in multiple fairs. There's a lot of video instructions on what we're trying to accomplish, and give us ideas. I think we want to grow with you. Our LinkedIn is basically job opportunities that are available at Gbuahn. Practice Fusion is what we're using right now, and a Patient Fusion patient portal is available, and we'll show you how to sign in so you can help us managing your care. Again, this is just a short video to demonstrate our application, the Gbuahn app. Thank you very much. This is Dr. Raul Vasquez.